Welcome to Fresh Vitals. Today, we're diving into the world of antibiotics. These are powerful drugs that help us fight infections and stay healthy. Let's explore what antibiotics are, how they work, and why they're so important. Number 1. Penicillins. These are some of the oldest and most widely used antibiotics. Penicillins work by attacking the cell walls of bacteria, causing them to burst and die. Common examples include Amoxicillin and Penicillin G. For instance, Amoxicillin is often prescribed at 500 mg every 8 hours for about a week. It's great for treating infections like strep throat and ear infections. But be aware of side effects. Some people may experience allergic reactions, such as rashes, itching, and swelling. If you have a history of allergies to antibiotics, tell your doctor. Number 2. Cephalosporins. These are broad-spectrum antibiotics, meaning they can tackle a wide range of bacteria. They work similarly to penicillins, by disrupting the bacterial cell wall. Examples include Ceftriaxone and Cephalexin. Ceftriaxone, for example, is often given at 1 to 2 grams once daily for 1 to 2 weeks, perfect for severe infections like pneumonia. Watch out for side effects like gastrointestinal upset and potential kidney issues. Always follow your healthcare provider's advice on dosage. Number 3. Macrolides. Moving on to macrolides, known for treating respiratory and skin infections. They stop bacteria from growing by interfering with their protein synthesis. Popular choices include azithromycin and erythromycin. Azithromycin is typically prescribed as 500 mg on the first day, followed by 250 mg daily for the next 4 days. Possible side effects? Some stomach discomfort and, rarely, liver issues. But for many, these antibiotics are lifesavers. Number 4. Fluoroquinolones. Fluoroquinolones, like ciprofloxacin and levofloxacin, are excellent for urinary and gastrointestinal infections. They work by disrupting bacterial DNA replication. For example, ciprofloxacin is often taken as 500 mg every 12 hours for about a week. However, be cautious of side effects like tendon damage and nerve pain. It's crucial to use these drugs exactly as prescribed. Number 5. Tetracyclines. Tetracyclines, such as doxycycline and tetracycline, are versatile antibiotics, commonly used for acne and respiratory infections. They target bacterial ribosomes, preventing protein synthesis. A typical dose of doxycycline is 100 mg twice a day for 7 to 14 days. But remember, tetracyclines can make your skin more sensitive to sunlight. Wear sunscreen and avoid excessive sun exposure. Number 6. Aminoglycosides. Aminoglycosides, like gentamicin and amikacin, are powerful antibiotics used for serious infections like sepsis. They work by binding to bacterial ribosomes, disrupting protein synthesis. Gentamicin is usually administered as 1.5 mg per kilogram of body weight every 8 hours for 7 to 10 days. Possible side effects include kidney toxicity and hearing loss, so they require close monitoring by your doctor. Number 7. Sulfonamides. Sulfonamides, like sulfamethoxazole and trimethoprim, are commonly used for urinary tract and respiratory infections. They inhibit folic acid synthesis in bacteria, which is essential for their growth. For example, Bactrim, a combination drug of sulfamethoxazole and trimethoprim, is typically taken as 800/160 mg every 12 hours for 7 to 14 days. Be aware of potential allergic reactions and gastrointestinal upset. Number 8. Glycopeptides. Lastly, glycopeptides like vancomycin are reserved for severe infections like MRSA. They inhibit cell wall synthesis in gram-positive bacteria. Vancomycin is typically dosed at 15 to 20 mg per kilogram every 8 to 12 hours for 1 to 2 weeks. Watch for side effects like kidney issues and red man syndrome, a type of allergic reaction. Conclusion. Antibiotics are incredible tools in fighting infections, but they must be used wisely. Always complete the full course prescribed by your doctor, even if you start feeling better. Remember, misuse of antibiotics can lead to resistance, making them less effective in the future. Thank you for joining us. Stay informed, stay healthy, and always consult your healthcare provider with any questions or concerns.